Do you have problems with nosebleeds? How about panic attacks, weight loss, nausea, fatigue, osteoporosis, or attention deficit disorder? What if I told you that these are all known symptoms of celiac disease, and that by changing what you eat, these symptoms could be relieved or even cured? In the next few minutes, I would like to communicate to you some details about celiac disease, a disease that has stumped doctors and patients for decades. I will define celiac disease, explain how it manifests itself in various patients, how it is diagnosed, and how it can be treated. According to the Celiac Disease Center at the University of Chicago, celiac disease affects 1% of average healthy Americans. That means at least 3 million people in our country have celiac disease. 90% of them are unaware that they have celiac. That's 2,910,000 Americans that are unaware that they are living with celiac disease. So what is celiac disease? Celiac disease is an autoimmune disease. A properly functioning immune system fights off foreign bodies in order to protect itself. With autoimmune diseases, the immune system instead attacks and destroys the body's healthy tissue. Mary Brophy Marcus of the USA Today article, Celiac Disease, It's Common and Commonly Misdiagnosed, vividly describes the adverse reaction. The body attacks itself, destroying normal tissue, in particular the villi and the small intestine. Normally, these tiny hair-like fingers act to absorb nutrients from food, but when the villi malfunction, the digestive system goes haywire. A simple but effective visual for this process is to use the fingers on the hand to represent the villi. The destruction of the villi results in food passing through or over without the nutrients being absorbed. In this case, the immune response, or the autoimmune response, is initiated by the presence of gluten from wheat, barley, and rye. WebMD states that celiac disease is found in the persons that possess either the HLA-DQ2 or HLA-DQ8 genetic patterns. These genetic patterns are present in 30 to 40% of the population. The presence of the gene does not mandate a celiac diagnosis, but indicates that the person could develop celiac disease. Statistically, 19% of aceliac's first-degree relatives, such as parents, siblings, or children, will also have celiac disease. So it's important to know your family's medical history, as well as to inform your family if you do get diagnosed with celiac. What we do know today is a result of decades of research by scientists and doctors. I would like to give you a glimpse of some of the ways celiac disease can present. These symptoms could be singular or in any combination. This is not an all-inclusive list, but a sample of some of the symptoms known, in many cases, to be caused by celiac disease. According to the Celiac Sprue Association, celiac presents itself, or manifests itself, in numerous ways, so many, in fact, that there is no typical celiac. Here are some of the symptoms that they describe: abdominal cramping and bloating, abdominal distension, increased appetite, back pain, constipation, blood clotting failures, edema, energy loss, fatigue, mouth sores or cracks, muscle cramping, night blindness, dry skin, tooth enamel defects, weakness, and weight loss. According to a study conducted by Dr. Peter Green of the Celiac Disease Center, the most common symptom is diarrhea. There are two tests commonly used to diagnose celiac disease. The antibody test, the least invasive, only requires a small blood draw from the patient, as well as that they are on a glutinous diet at the time. This test is 90% accurate. The second test is a biopsy of the colon, and that is the standard test. Any celiac who gets a blood draw should also have the biopsy to confirm the diagnosis, as it is a 100% accurate test. Currently, there is no pill, surgery, or other medical solution to treat celiac disease. But keep at heart, because celiac is not like other autoimmune diseases. Because the trigger for celiac disease is external, gluten, switching to a gluten-free diet will eliminate further damage to the intestine, allowing for healing and eventually proper absorption of the foods that you consume. Depending on the severity of the damage, it could take up to and possibly beyond 5 years for the intestine to heal. Some of the symptoms may go away, while some of the systemic issues caused by malabsorption may persist, such as attention deficit disorder, arthritis, thyroid disorder, or diabetes. A newly diagnosed celiac will need to replace the protein and iron and other vitamins that they won't be receiving through the traditional grains. A dietitian can provide all the information needed to rebuild a diet from scratch. For example, white or starchy flours such as rice, tapioca, or cornstarch typically do not have sufficient iron or protein content. Find a recipe book. Go back to the basic meat and potato meals. Going back to the old meat and potato recipe meals gets old quickly. In order to skip some of the frustration of trial and error cooking and enjoy eating quickly, find some tried and true recipes. One well-known author is Betty Hagman. She has written several recipe books and has many great dessert recipes. Also join a support group. Support groups can do wonders for helping you get started. Some of the things that they offer are potlucks and recipes, starter kits and goodie bags, insight and experience, as well as empathy and solidarity. With a plan, one can stay committed to the diet and survive celiac disease. Over the last few moments, I gave you a working knowledge of celiac disease. We discussed what celiac is, what to look for, how to be diagnosed, as well as how celiac disease can be treated. Celiac disease is a sneaky and difficult disease to deal with because it shows itself in so many different ways from person to person. Once diagnosed, an individual faces major life-changing impacts, but healing can start immediately. Thank you.